First Aid, Emergency Care, and Disaster Management. So please get your book. We're on chapter 63 because this is an important chapter. When anyone finds out that you are a nurse or a medical professional, they're going to come to you for help in an emergency situation. So a couple months ago, I heard a knock on my door, and they said, "We heard you're a nurse. Can you come? There's a man in the street and his head is bleeding." So I walked out of my house, and there is a man, like in the gutter, not in the middle of the street, luckily. He was in the gutter, and his head was bleeding. I think he had been drinking and probably fell. So what did I do? So I just remain calm. I give people jobs, like we need a blanket to keep him warm. Let's elevate his feet. Let's stop the bleeding. So those three things I could assess right away and call 911 because we needed some help, further help. But because I remained calm and I gave everybody a job, everybody felt good. And the other thing you need to do also is to tell the patient that you're going to take care of them. Let them know that they'll be safe, that you're there. People are going to be there to help you. 911 has been called, and be sure that everyone feels confident. All right, so cardinal rule, remain calm. So you come across a situation, you don't know what you're walking into at first, so remain calm. Priority is to preserve life and minimize the effects of injuries. So the manner in which you conduct yourself can soothe and reassure the patient or the victim. So touch, calm voice, "I'm here, I won't leave, we'll take care of you." Assessment and intervention must be done quickly and efficiently to identify and treat priority needs immediately. So again, if you give people jobs, get me a blanket, keep him warm, we need a pressure dressing for his head, and somebody call 911. So everybody gets involved and everybody helped in this emergency situation. So when you come across a situation, you want to survey the scene. Remember, like in our CPR classes, we always learn that we have to survey the scene. We have to be sure that it's safe for us to go out to help someone. Because if it's not, then we get hurt, and then we can't help the person that is really hurt. So we want to do a focused assessment and a primary survey where we check the situation. We want to check the victim's name and determine if they can speak, reveal if they have an airway or a neurological problem. So that's your primary survey. Evaluate for breathing. Now this is on page 1244 if you want to follow with me. The primary survey. Evaluate the airway for breathing. Initiate CPR if you need to do that. Look for uncontrolled bleeding. We'll talk about that a little bit later. Assess for any disability, which includes the level of consciousness. Facilitate the family by allowing them to be close to the patient. Look for a medical alert bracelet. That's important because it may tell you if they're on a blood thinner. So if they're bleeding and they're on a blood thinner, it's going to be a lot more than they're not going to have any clotting factors. So you want to do a quick primary assessment, and then a secondary assessment is actually a quick head to toe. Just look them up and down and see if there's anything else besides the apparent injury. So guidelines for first aid and treatment is protect the airway. And that could just be lifting the chin, right? Get that tongue from obstructing the airway. Splint injured parts. Now this is important. If you splint an injured part, it has to be in the position found. Because if you try to fix it, you could cause more injury. So just splint it in the position found. prevent chilling, but don't add excessive heat. We wouldn't want to add too much heat, but a blanket's good. Do not remove penetrating objects. Because if you do, you're opening up something that could be bleeding profusely. Because actually, when there's an object in the abdomen or the chest or the head, it's stopping bleeding. So you don't want to remove them. In fact, sometimes I've seen people who have fallen on a spiky part of a fence, and the fence is protruding through their body. And when 911 is called and they come, they cut the fence or the metal and take that with them to the emergency room, because they will not remove it at the scene because it could cause more injury. So they need to be in a hospital for a penetrating object to be removed. Also, keep the patient NPO. I know they may feel dry and they want to drink. That may be because they're dehydrated or hypovolemic, but we don't want to give them anything to drink because, they might aspirate. That might be one thing. Also, what if they need surgery when they get to the hospital? So we want to keep them NPO. And then we want to stay with them so that they feel like they're not alone. So some nursing assessments in emergency. So we need to know this sample. So under health history on page 1244, it talks about the acronym SAMPLE. An acronym means that each letter stands for something, but it helps you remember. So just remember the word sample, and then if you know S, what does S mean? Symptoms. So what are the symptoms? What symptoms do they have? A, allergies. Do they have any allergies? M, medications. What are their current medications? P, what's their past illness? Have they had any past illnesses? Or are they pregnant? So the P is a double. Also, of course, you can tell if they're pregnant or not, right? Last oral intake. So that's the L, last oral intake. And then events, E is events related to the injury. So you need to learn that sample. So please highlight that in your book on page 1244. Very important. And then what is the reason for the problem? The signs and symptoms, the circumstances in which it happened. Is the patient unconscious? How long have they been unconscious? If there's anyone else there, you can ask them the questions if the patient's not able to answer you. Medical treatment. Has they had any medical treatment in the past or recently? And then their past health history. So we want to know any problems that they've had in the past, breathing, diabetes, heart problems. So we want to know all of that. And then the physical exam, we want to know our ABCs, right? Airway, breathing, and circulation. So we always want to follow our ABCs. So airway is pretty easy to check. Is their chest rising and falling? Is there air coming from their mouth? Then as far as pulses, palpate the carotid. That's the closest right there in the neck. That's the easiest to feel. It's a large artery right coming off of the heart, so it's a really good pulse to check. The carotid pulses. And also peripheral pulses. So you can check the peripheral pulses, radials, pedals. And when you're checking pulses, I'm going to talk about this again, but when you check pulses, if you can't feel the distal pulse, move up to the next pulse. So let's say you're on your pedal pulse. You don't feel a pedal pulse. So where are we going to go next in the leg? Post-tibial. Check a post-tibial pulse. Can't feel it? Go to the femoral. Go behind the knee, the popliteal. And then go to the femoral. Femoral should be pretty strong there. So if you're in the arms, you'll go radial, antecubital, right? So move on up with the pulses. All right, so we've got our ABCs. We've listened for the breathing. We've palpated our pulses. We want to check our level of the patient's level of consciousness, the pupillary responses. If we, you probably don't have a pen light on you, right? But you could put something over their eye, just like a piece of paper, and then pull it away to see if their pupils, or even just opening their eyelid, because it's dark when their eyelids are closed, and then when you lift up their eyelid, their pupils should contract. All right. Look for any obvious injury or bleeding, swelling, bruising, drainage. So you're doing a quick head to toe, a quick assessment. Because when the 911 people come onto the scene, they're going to say, what happened? Well, you can tell them what you've assessed, and that's really helpful for them. They'll say, what happened? What happened? Well, I found this man in the street. He's bleeding. We've kept him warm. I had no blood pressure cuff with me, but I couldn't take vital signs. But at least I could tell him that, oh, he fell. He lives in the neighborhood. By then, his family member had come over. So, 911 wants to know everything. So as much as you can tell them, they would really appreciate that. Okay. So cardiopulmonary arrest. So this is a specific emergency. Now we're going to be talking about specific emergencies. Those were general, overall emergencies. When you just happen to find someone. Now we're going to talk about specific. So this is cardiopulmonary. So remember that brain cells begin to die after 4 minutes. Cardiopulmonary arrest is the absence of a heartbeat. But the cardiac and respiratory system work so together that the brain doesn't die until 4 minutes, even after the heart stops beating. So you want to call for help. And that's what we do in our CPR classes, right? Help, help, please somebody help. So get help right away as fast as you can. Prompt recognition and treatment of cardiopulmonary arrest can maintain the oxygen supply to the brain until circulation and respiratory are restored. So remember your CPR. And what are the causes? Well, it can be a cardiac issue, an MI, or maybe heart failure. It could be electrocution. It could be drowning. It could be a drug overdose, anaphylaxis, or asphyxiation. So all those things can cause the heart to stop. Electrocution, that's a shock. So that's how we start the heart, but it can also stop the heart. So that could be a problem. Signs and symptoms of an arrest is no pulse or respirations. So you want to assess that. You want to do a good focused assessment, basically checking for oxygenation, heartbeat, respirations, their skin color, checking their pulse. And then you might have to start CPR. Choking or airway obstruction. So choking is an airway obstruction caused by a foreign body that enters the airway. So this could happen in a restaurant. I always think of Mrs. Doubtfire when I think of this one. Could happen in a restaurant. It could happen anywhere, in the mall, at home. So the initial response when a person appears to be choking depends on the severity of the airway obstruction. So you want to see, is the patient coughing? Are they making noises like stridor? And stridor is like a real high-pitched noise because air is going through a narrow airway. So it's a high-pitched noise. But at least it's a noise. It's air going through a narrowed airway. So if they do move any air at all, now I'm on page 1246, don't do anything because they may be able to cough it up themselves. You want to encourage them to cough and breathe. And then if that doesn't work and if they lose consciousness, then you can do your thrusts. The severe airway obstruction is poor or no air exchange, which is the high-pitched noise like stridor. And that is the inability to speak. Interventions, if they do become unconscious, you want to do the abdominal thrusts. And there's a really good picture there on page 1246. Remember, the universal sign of choking is hands on the neck. And notice the abdominal thrust for the conscious choking victim. You get behind them and you just do the squeezing of the chest. And then if they become unconscious, you have to do the abdominal thrusts. So prevention, cut the food, chew your food, don't laugh and talk at the same time that you're eating. So here's the universal sign of choking. Can you breathe? Can you talk? Because right now you can see she's just grabbing her throat because she feels like something's in her throat. And here's the abdominal thrusts of a conscious person. Here they become unconscious. And you're doing the abdominal thrust. Now, I know you've all had this in CPR. How about shock? Shock results from the acute circulatory failure caused by inadequate blood volume, heart failure, overwhelming infection, severe allergic reactions, extreme pain or fright. Now, we talked about shock. There was a whole chapter on shock. And it did talk about all these types of shock. And circulatory shock, if you remember, that's failure, they're bleeding or they're hypovolemic, right? Inadequate blood volume. Heart failure, well, their heart's not pumping well. Overwhelming infection, you see, now when we get into heart failure and infection, allergic reactions, we need help to help this patient because we can't do anything for the heart. They might need medications. The same as with an overwhelming infection. They need antibiotics. Severe allergic reaction. They might need epinephrine. Maybe they had an epi injection with them, but maybe it wasn't working. Extreme pain or fright. Well, they might need something to relax them with that. So we get them help as soon as possible. So this is going to go with our hemorrhage talk. So these are major arterial pressure points because if pressure does not stop bleeding, you might have to go to indirect pressure to stop that artery that supplies the blood to the area that's bleeding. So this is called indirect pressure. And this is in your book, figure 63.3. So let's talk about hemorrhage then. So it's the loss of a large amount of blood The loss of more than 1 liter in an adult may lead to hypovolemic shock. And uncontrolled bleeding can result in death. So you see, we can help. So we want to do a focused assessment. So you want to assess their signs and symptoms of hemorrhage. Where are they bleeding from? And what about their skin? Now, you should know by now what the symptoms of hypovolemia, whether it be dehydration or hemorrhage. And those are, repeat again, cool, sweaty, pale skin, weak, thready pulse, rapid respirations, and decreasing alertness, decreasing blood pressure as well. The victim who's bleeding internally may also have abdominal distension. So if their abdomen is big and hard, that's distension. Maybe they're bleeding internally. And again, if you know the circumstances of what happened, you might be able to tell if they are bleeding internally. But one thing, let's say they had an ulcer that ruptured, and that's internal. Now they might have hemoptysis or hematemesis, where they're coughing up blood, but maybe not. Maybe it's just staying all in their abdomen. So you would need to be aware of that. But also, because they're bleeding internally, they're going to have those same symptoms of hemorrhage. And that's the thready pulse, the low blood pressure, the sweaty skin, the pale skin. And also you want to ask if the patient has any bleeding disorders or are taking any medication. So if they have a medical alert bracelet, check what medication they're on. So your intervention would be to immediately apply direct continuous pressure with or without gauze. Now I want to tell you a little story that happened to me here. I was stopped at a stoplight and there was a car accident right in front of me, and I had the kids in the car. They were little then. And of course, my initial response was I pulled the car over and I jumped out. And I ran to the car that got hit, and it had an older man and an older lady. They were still in the car. And she was bleeding from the seat belt. So I took off my sweater and I put pressure on the bleeding. Now, I never saw that sweater again, but that's okay. Then 911 came and helped the lady. But my initial response was to stop that bleeding. So that's what you want to do. So I didn't have gauze. All I had was a sweater. And maybe all they have is a jacket or a blanket. Anything you can get to stop the bleeding. Doesn't have to be sterile. It'd be great if it is, but how many people carry that around? Place the patient in a supine position. Well, I didn't want to move the patient out of the car, so I didn't do that. Elevate the feet 6 to 12 inches unless it causes pain. Elevation decreases blood flow to the area. After the bleeding stops, secure large dressing, if available, over the wound. Reinforce the dressing, but do not change it. So if there's still bleeding when you put something on that wound, if it keeps bleeding, keep reinforcing it and put pressure on it until you can get help. But don't keep changing it, because every time you take it off, it bleeds more. So just keep piling on pressure, sweater, towel, whatever you have. They don't recommend using a tourniquet because not everyone is trained in using a tourniquet, so most people don't use that. It says the least dangerous tourniquet is a pneumatic one, such as a blood pressure cuff that allows control of pressure if you happen to have a blood pressure cuff. Once the cuff is inflated, only a physician should remove it. So once you've applied the pressure, that's where you stop. You don't take it off and put another one on. You let the specialist deal with that. All right. So now that we've established that we reinforce the dressing and apply pressure, that's good. Epistaxis. So what do you do about epistaxis? So the most anterior nosebleeds respond to pressure. Instruct the patient, this is important to remember, sit down. Lean the head forward to prevent aspiration of blood. Pinch the nostrils of the patient shut for at least 10 minutes. Very important to remember. Okay, we're going to go on to, here's a good picture of the patient. Help you remember visual, head forward, pinch the nostrils, 10 minutes. So traumatic injury. So the first thing we'll talk about is fractures. So, and we are going to talk about a whole chapter about fractures. So I'm just going to kind of touch the main points here. So a fracture is a break in a bone that may be described as simple or compound. And we know compound breaks the skin. So you might see a bone sticking out of the skin. Now, you really don't want to apply a lot of pressure to that because there's a bone there. And that is just an infection waiting to happen there. A simple or closed fracture does not break the skin. And like I said, the compound fracture, the bone protrudes from the skin. So now I'm on page 1248 if you want to follow with me here. So let's talk about strains and sprains. So a strain is an injury to a muscle or the tendons that attach muscles to bones. And sprains are injuries to ligaments. Then we've got head injury. Head injury is not always apparent immediately after an accident. It should be suspected with any type of blow to the head or a fall, though, especially if they lose consciousness. But not everyone loses consciousness when they bump their heads. Natasha Richardson, if you remember, this has been years and years ago, but she was on the bunny slope with her kids and she fell and bumped her head, but didn't think anything about it because it didn't hurt that bad. But she did want to go back to the cabin after skiing with the kids, and she died. She didn't get medical help in time because she didn't think it was that bad. So just remember, any head injury can be a problem. Now, how do you assess a head injury in an older person? Because older people, you know, they are in a state of confusion a lot of times, and they may not be walking straight as it is. They might have trouble walking. So we want to remember that head injury in an older person may be overlooked if a state of confusion is attributed to age. Oh, they're confused because they're old. No, maybe they fell. So be sure you determine their usual state of mental function before the fall. And you want to do a focused assessment. Signs of increased intracranial pressure are change in behavior, agitation, confusion, decreased level of consciousness, pupil dilation or constriction. They might not even be one is big and the other is small. Impaired sensory or motor function. Increasing blood pressure with widening pulse pressure. Remember, that's more between the diastolic and the systolic. That's a widening pulse pressure. Meaning, like, instead of 120 over 80, it's 140 over 60. That's a wide pulse pressure. Be alert for leakage of cerebral spinal fluid. So I remember when I was a kid, there was a boy who had a paper route at the time. Boy, that was really a long time ago, right? So he was hit by a car and fell, and no injuries except that clear fluid was coming out of his ear, cerebral spinal fluid. So look in the ear. If you see any clear liquid, it could be cerebral spinal fluid and they've had a major injury. So be alert for leakage of CSF, and a lot of times it is in the ear. All right, the victim of a head injury must be assessed by a physician as soon as possible. And like I said, even if the head injury is minor, the physician may admit the victim for observation, because sometimes there's a little bit of bleeding in the head, but then it becomes more and causes, there's nowhere for blood to go, or swelling in the head, except for causing injury inside the body. So just remember, head injuries are very, we really have to keep an eye on those. So let's talk about neck and spinal injuries. So just don't move the patient, because if you can make them worse. 911. Call 911. So after a diving injury, the neck and back should be immobilized while removing the victim from the water. Now, the way you can immobilize someone is rolled towels or blankets to keep their body in alignment. And that's important, alignment. Eye injuries. So because our eyes move together, if there is an eye injury, you need to cover both eyes. Because if one eye is moving, that means the injured eye is moving also, and we don't want that to happen. If something went in the eye, a foreign body or a penetrating object or an irritant, we don't know what it is, but just try to cover both eyes and get them some help as soon as possible. Ear trauma, the position and structure of the external ear make it vulnerable to traumatic injuries. The most serious injury to the external ear is avulsion. What a good word. Avulsion means that all or part of the auricle, that's the outside of the ear, is torn loose. Avulsion. So we want to watch for that. Now I want to turn your attention to a couple of tables. So table 63.1 on page 1250 calls your attention. This is back to the eye injuries. So under foreign bodies, it says embedded foreign bodies should be removed only by a physician. And then in perforation of the globe, that's the globe of the eye. So important to remember, protect the injured eye by covering it with a shield that does not touch the object. An inverted paper cup can be taped over the eye. Patch the unaffected eye as well, because the eyes move together. This precaution limits the movement in both eyes. Tell the patient why both eyes need to be covered. So that's important for you guys to note on table 63.1. Then I believe the next one is chest injury. So I'll call your attention to table 63.2 on page 1251. So there's different types of chest injuries. There's a pneumothorax. An open chest wound penetrates the pleural cavity, allowing air to enter, which could collapse a lung. Now here you need a vented dressing. In MedSurg 2, we're going to talk more about vented dressings. What a vented dressing is you cover 3 sides of a 4x4. So when the patient sucks in, they close the wound, and then when they breathe out, it allows air to escape. So that helps with a pneumothorax, a vented dressing. A flail chest is where the ribs are broken and the chest is kind of moving in an uneven movement. So abnormal chest wall movement, and that's called paradoxical because they're moving at different times. And that happens a lot of times after a car accident and maybe the patient hit the steering wheel and broke the chest, the sternum, and some ribs, and they're going to have uneven chest movement. And remember that if they have a broken rib, that can puncture a lung. So there's a double injury there. Then we have a hemothorax. Well, that tells you there's blood in the chest. That's blood accumulating in the pleural cavity, and that can cause the lung or lungs to collapse because blood is going where it shouldn't be, and it's taking the space of air, so they're not getting oxygenation either. And then there's another one called cardiac tamponade. Now this can be really, really bad. It's the presence of blood in the pericardial sac. So remember, the heart is covered with a sac, the pericardium, and in that sac is fluid so that the heart can contract easily. It's going to expand and contract easily in a sac. But if that sac is broken, and blood goes in there because maybe the heart got injured or some other type of injury, that's cardiac tamponade. And then what happens? Because there's not fluid in the sac, there's blood in the sac, and that prevents the heart from moving, contracting, and constricting and contracting and expanding is what I mean. So signs and symptoms include respiratory or circulatory failure. So you need to get them to the emergency room as soon as possible. Prompt treatment. Now, some signs of cardiac tamponade, how do you know, right? Because you can't see inside of their body. With respirations, you can kind of tell by their breathing, and maybe eventually you'll be able to tell cardiac tamponade also, because they will have a weak pulse because their heart is not contracting well. It's trapped by blood. They might have a low blood pressure also. Their neck veins might be enlarged because that blood is backing up into their neck veins because it's not being pumped properly. Also, muffled heart sounds. Now, treatment for that doctors would do would be a pericardiocentesis. And what they do there is they put a needle into the pericardial sac and aspirate the blood. They also would probably have to go to surgery and have that sac closed so that the body will naturally build up the fluid that it needs in the sac, but you need to get the blood out. So the doctors can do that, get the blood out around the heart and close the sac up, and then the fluid will just automatically be made by the body. So those are major injuries, aren't they? Then there's an abdominal injury. So we talked a little bit about abdominal injuries, evisceration. So that's where the protrusion of internal organs come through a wound. Now, you know, gunshot wounds, knife wounds, car accidents, this can happen. So the main thing that you want to do in treating this is to cover with a saline soap dressing. Now, I know it'd be great if it was sterile, but we probably don't have anything sterile. But you need to keep it moist because organs are used to being in a closed environment and they're moist. So we don't want them to dry out because that can lead to ulceration and further injury for the patient. So remember to cover eviscerated organs with something like plastic wrap or foil if you have that, to keep the moisture in and the warmth as well. If you have a saline soap dressing, that's great at the scene of an accident, even a clean cloth, and get the patient to the hospital. Now, traumatic amputation is another one I want to talk about. Tell you a story here. I had a niece, well, I still do, but she's older now, but when she was 4 years old, she could barely step from the porch up to the, where the door is, that big step there. So she put her fingers on each side of the door to help herself up. Well, it was really windy that day and the door got blown shut by the wind on her fingers and cut 3 of her fingers off. So we immediately grabbed those fingers, put them in a plastic bag, with cold water and rushed her to the hospital. The doctor sewed them back on, and she has 3 functioning fingers, and she's fine. But what you need to do if you happen to find something like this is to, a body part that is completely detached should be wrapped in sterile gauze, moistened with sterile saline. Place it in a watertight container such as a resealable plastic bag. Now, these are ideal situations. If you don't have this kind of thing, just try to keep those fingers moist. If you don't just put them on ice though, because ice can injure the tissues. You can put them in an iced bath where there's ice in the water, but you don't want to put the tissue right next to ice. All right, amputated extremities may be healthy enough for reattachment for 4 to 6 hours. Okay. Now this is just a picture of, and you have this in your book also on page 1250. This is the paradoxical motion caused by loss of chest wall support. And you can see the lungs, how they move from side to side, and you can see the ribs where the arrows are. Those are some ribs, and the sac around the lungs. Remember, there's a sac around the lungs too, so that they can expand and contract. So if that gets punctured, that can cause a problem and make the lung collapse. We're going to talk about this a lot in mid-surg too. So this is just an introduction. This is emergency care. So you can see the problem up on inspiration where the air gets sucked in and that lung collapse, and then on expiration the air gets pushed out. Okay. So burns. Well, I know we talked a whole lot about burns already, but what do you do? So you want to assess the type of burn that the patient had. So how did it happen? Were they cooking? Was it a campfire burn? Were they in a burning house? What kind of burn is it? And of course we want to have, if they're on fire, stop, drop, and roll. I just saw on TV, all the problems they're having up in Oregon, and somebody threw a Molotov cocktail that was burning, and a guy, his feet were on fire. So you know what he did? He ran. You don't run when there's a burn. You stop, drop, and roll. So everybody was, once he fell down, everyone was trying to put out the fire on his feet. So remember, stop, drop, and roll. Smother the flames with coats or blankets. If it's no water, if there's chemicals or flammable liquids present on the clothing, and remove the burning or smoldering material from the victim. Now I will tell you a problem with that, and that is that sometimes when you pull burning clothing off, it's good to do that, but you might be pulling some skin off also. So you're going to have to maintain some cleanliness in that area where the burn was. And remember, protection of the airway, very important. If you see soot around the lips, remember, sooty sputum. So maybe it's an inhalation injury. Maybe they inhaled the burning. Maybe they were in a house and it was burning and they inhaled smoke. So you may see smoke around their lips. That means maybe their trachea is burned as well. So they're going to have some lung issues. So be sure they have a patent airway. And when someone does arrive on the scene, you'll be able to tell them what you see, and so they can get the right help. Now let's turn the page to page 1252, and there's some emergency interventions for burns there on table 63.3. I want to call your attention though to table 63.4 on page 1253. So this is where they talk about heat and cold exposure. So the first one on this particular table is heat exhaustion. So that's caused by excessive fluid loss when exposed to high environmental temperatures and humidity. Now this could be they're out in the desert, maybe they got lost, and they're exposed to heat. There's nowhere for them to no trees or anything. So how do you treat that? How do you treat hyperthermia? Let's say it could even be at the swimming pool, and they've been out in the sun and sunbathing, and they're sweating and they're losing their fluids and they're getting hot. Well, the best thing for you to do is get them to a cooler environment. Pull them under a tree, take them into a building where there's air conditioning. So for hyperthermia, when they're really hot, we want to move them to a cooler environment. And heat stroke is the same thing. So that's a body core temperature of 106. Wow, that's hot. So temperature regulating mechanisms in the brain fail. Heart, kidneys, and central nervous system functions are depressed. So they're bad. They're gonna go downhill really quickly. So we want to take these people into air conditioning or shade, apply wet, cool towels to their body, ice packs to their forehead, anything to start cooling them down as quickly as possible. So that's for hyperthermia. Now remember, there's the opposite, hypothermia, where they're really, really cold. So frostbite is a serious cold injury. The blood vessels in the skin constrict, and they're not getting blood to their extremities. So as tissue warms, the skin turns bright pink and blisters. Rewarming is very painful. If the procedure is performed in a medical facility, analgesics will be ordered before rewarming because it's so painful. But I want you to pay attention to hypothermia. So frostbite's going to be kind of rare for you to see unless you go hiking up into the Himalayas. So hypothermia, though, you can see, this is where the rectal temperature is lower than 95. Signs and symptoms would be shivering, impaired performance. Then that would progress to chilling, which decreases heart and respiratory rates and blood pressure. They might get an irregular heart and breathing pattern as well. So what do you do for that? Well, you wrap them in warm clothing. So that's good. But I really want you to remember about hypothermia, decreased heart and respiratory rates, and blood pressure, irregular heart rate, and a irregular breathing pattern. And warm them up with a warm clothing, warm jacket. I'll tell you a funny story here. So my son went hiking with some friends, and they started out in the daytime, 4 of them. And then, of course, 2 decided to go one way and 2 decided to go to the other. Well, my son was in with another guy, and they got lost. And they were in the woods, and they didn't have a compass. And their phone cell didn't work. And it started getting dark. And, you know, they just had to huddle together to keep warm. They had to use the warmth of each other to stay warm. Of course, now we tease him that he was cuddling with another guy up in the mountains, but that's just a joke because it really isn't funny, though. Hypothermia can be very dangerous. And when daylight came, they found their way to a road, and apparently people had been looking for them. Thank goodness I didn't know that at the time, or I would have been freaked out. Okay. But it can happen easily. I think that's another point, because my son's a hiker, so it can happen. So you got to be prepared. So let's talk about some poisoning now. Carbon monoxide poisoning. So carbon monoxide poisoning, that's where carbon monoxide binds to hemoglobin more readily than oxygen. So this carbon monoxide binds and the oxygen does not bind. So they're not getting enough oxygen. And it soon occupies many of the sites of the hemoglobin needed to transport oxygen to the cells. Now this is on page 1254 under carbon monoxide poisoning. So the victim becomes hypoxemic, so they're not getting any oxygen, and they can die. So you want to evaluate for early signs and symptoms of carbon monoxide poisoning. Remember, everybody should have a carbon monoxide detector in their house, because carbon monoxide can build up and it doesn't taste, it doesn't smell, so you don't know if you're getting poisoned by carbon monoxide. So anyway, signs and symptoms include headache, shortness of breath with mild exertion, dizziness, nausea, vomiting, and mental changes. A victim usually dies when the carbon monoxide bound with hemoglobin exceeds 70%. So if you do an O2 sat, their oxygenation will be low because they have no hemoglobin to carry the oxygen. So that can be a good check for you. The other thing is their skin is cherry red. Their skin color is cherry red, but then it goes to pale and bluish with reddish mucous membranes. So I actually saw this occur to a patient that we brought into the ICU. Young gentleman, a bunch of him and some other guys were messing around, and I don't know exactly what they were doing because it was an urgent situation. We got him in, and we had to open his chest and do cardiac massage to try to get him his blood pumping and get him, get him intubated and get oxygen into his lungs. But we were unable to save him because the carbon monoxide had just was too much for his body. So just know it's an important thing to be aware of. All right, so what do? Well, you move the victim of carbon monoxide poisoning to fresh air and call for help right away because it can go down really bad, fast. Okay, now let's talk a little bit about food poisoning. So this begins on page 1255. We can actually talk about drug or chemical poisoning also. Let's talk about that first, okay? So if there's a drug or chemical ingested, call poison control. Don't just automatically encourage vomiting because some things that are irritating going down the esophagus, if you encourage them to vomit, it's going to irritate it again coming up. So be sure you call poison control. Treatment, once they get to the hospital, is activated charcoal. And what that does is, we used to do this for patients who had taken drug overdoses. We put a big old tube down the nose into the stomach and put activated charcoal into their stomach and intestines. And what that would do is that absorbs, it prevents absorption of the body of all the drugs. So it lines the intestines and the stomach to prevent any further, the body from absorbing any more of the drug. So that's the treatment, activated charcoal. And remember, you could even have the number for poison control on your phone in case that happens, especially some of you who have kids. It's really important. I knew another story of a guy, red cups, right, at a party. Well, you're sitting around drinking, having fun, and you put your red cup down. Somebody put gasoline in it, and the guy just picked up his red cup and chugged it, and it was gasoline. And it was irritating going down, and there happened to be someone at the party who was a doctor and told him to vomit it up, but that was the wrong thing to do. So be sure that you know what to do, poison control, and get them help as soon as possible. All right, let's talk about food poisoning now. So, food poisoning is caused by ingesting contaminated food. Contaminants can be bacteria, chemicals, or natural toxins. Bacteria most often associated, now this is important to know, the one that's most often associated with food poisoning are not only Clostridium botulism, but Staphylococcus aureus. So if you even look at table 63.5, it lists the organisms, Clostridium botulism and Staphylococcus aureus, Clostridium perfringens, and Salmonella. So you've probably heard of all of those. But the one that is due to poor hygiene of food handlers, inadequate refrigeration of food, especially milk products and mayonnaise. So like that egg salad or the potato salad at the party. Staphylococcus aureus. That's the most common type of food poisoning. Okay. So let's turn the page and go to page 1257 where we're going to talk about bites and stings. So some people already know that they're allergic maybe to mosquitoes or ants, so they have an EpiPen with them. That's great if they know that they're allergic to something. But what if they get bit or stung by something that they don't know they're allergic to, or that have dangerous bites and stings? So under patient teaching on page 1256, it talks about insect bite allergies and how the patient should have an allergy treatment kit with them if they are allergic to anything and they're going hiking or going to the woods or going on any trips. But let's look at table 63.6. So remember, you do need to do a focused assessment. How did it happen? What does the bite look like? The symptoms after the bite: pain, edema, numbness, tingling, nausea, fever, dizziness, dizziness or dyspnea. So interventions of specific bites. So let's look at a snake bite first. So venom that is injected through the fangs into the victim may affect the nervous system. That's called a neurotoxin, or the blood and blood vessel. So they need to seek medical care immediately. You need to know the type of snake it was if you were there, or they need to notice what it was that bit them. Maybe they don't know. They might need an anti-venom, and they have a lot of those for different snake bites. So that will help the patient if they get it within 6 hours of the bite. So get them to the hospital as soon as possible. Insect bites. Common reactions to an insect bite or sting is itching, edema, and erythema or swelling. People who have serious allergies that get hives could have a fatal anaphylaxis because their airway swells and then they can't get oxygen. So it's really important to get them help right away. Characteristics of anaphylaxis are difficulty breathing, drop in blood volume, and blood pressure. And they can lose consciousness and die. So let's talk about an animal bite. You can see I have a couple pictures here on this slide. One is a black widow, and one is rabies, or a raccoon that might be, or an animal that might be carrying rabies. In this case, it was a raccoon. So all animal bites should be taken seriously because of the risk of wound infections and rabies. So rabies is an infection of the central nervous system that is almost always fatal. So important for you to know under interventions is advise the patient to have a tetanus shot, or have you had a tetanus shot recently? Because if they have, then they probably won't have the run the risk of having rabies. But if you aren't able to catch the animal, it could be a dog even, maybe even your neighbor's dog. Hopefully they had a rabies shot and you had a rabies shot, you'll be fine. But you need to be sure that everybody's immunizations are current. Human bites can be dangerous because of the risk of infection. So you want to clean out that bite and get some antibiotics. Let's turn the page to page 1258, and this is where our spider bite is. There is a tick bite that comes before this. They require attention because ticks carry organisms that can cause Lyme disease and Rocky Mountain spotty fever. Well, that's bad, isn't it? And it did talk about Lyme disease over on page 1256. Untreated Lyme disease transmitted by the deer or tick can have serious chronic effects on the brain, eyes, joints, muscles, heart, blood vessels, lungs, skin, liver, spleen, stomach, and intestines. So if you go outside, if you go camping, be sure you wear long sleeves, pant legs to prevent getting a tick bite. So let's go back to table 63.6 and talk about spider bites. So most spider bites cause only local irritation, but black widow, the venom is neurotoxic. It causes pain, nausea and vomiting, fever, weakness, muscle cramps, and headache. Most serious effect, respiratory distress. So that's important to know. Man, if you get bit by a black widow and you could start having trouble breathing, that is an emergency. Respiratory distress can go into hypertension, seizures, and shock. So black widow is shiny. I have a picture here for you. Shiny black with a red hourglass on its abdomen. The treatment is antivenom, and that's available at the hospital. So you got to get them to the hospital as soon as possible. Brown recluses are dangerous as well. You can read about that here in their book. It's a fiddle-shaped mark on their thorax. Medical attention needs to be sought for those bites as well. All right, so, but I can see here, I'm kind of pointing you to the two important things to know, black widow and rabies. Hey, let's try a question. So which of the following general guidelines for first aid treatment of emergency patients is incorrect? So let you read it for a minute. So which one is incorrect? It's D. You never remove penetrating objects. Okay. So let's talk about bioterrorism. This seems to be a problem nowadays. It's a deliberate release of pathogens to kill and injure people. And it's called terrorism because they want to make you terrorized. Terrorized to go to parties or to go to a marathon or anything where there's groups of people, football games. The most common biologic agents in terrorist attacks would be anthrax, botulism, the plague, smallpox, and tularemia. Now, the CDC has all of these, does have some anthrax and botulism and plague and smallpox. It does have them kept under lock and key, but other countries make it, right? They find it. they get a hold of it and they can release it. It's easily spread, potential to cause many deaths. Now, it could be released in water. It could be released in the air. Healthcare providers must know how to protect themselves and others. Staff should know where to obtain PPEs or personal protective equipment and what types of precautions should be taken. So it talks in the book about going to a hospital in the event of an outbreak of disease related to bioterrorism. Healthcare providers must know how to protect themselves. So the CDC does have a list of things how to take care of these situations. Best thing is to get into the hospital where they know how to take care of everybody, and they can get you in isolation and take care of you. Staff should know where to obtain PPEs and what types of precautions. Patient isolation should be taken. Now, I've seen medical shows where a person comes in and was exposed to a biologic agent unknowns to them, and then they end up infecting other people in the emergency room, and that's happened too. That's another way where a release of pathogen by a person can kill and injure people. So isolation is important, and protecting yourself and others is important. I also believe on page 1259 there is a list of bioterrorism weapons, the biologic agents that cause these weapons, like anthrax, what happens to your body and what do you do about it, what treatments. So it lists anthrax, botulism, pneumonic plague, smallpox, and tularemia. So it does give you a list of all of those if you're interested in reading about that. And it is important for us to know because knowledge is power, isn't it? I'll leave some of this reading to you guys though. So how about disaster planning? So it's a challenge for the healthcare system to be ready for natural disasters like hurricanes, floods. There's been, not hurricanes, but, well, I lived in the Midwest and we had a lot of hurricanes. I can't think of the word I'm trying to think of. But anyway, it's a challenge because there's short warning. Earthquake, that's what we worry about over here in California. Earthquakes, there's no warning. Tornadoes, that's what I was thinking of, tornadoes in the Midwest. Well, we used to have a big horn that would sound when there was a tornado seen in the distance, and people would have a chance to get in their basement or get in a doorway or a bathtub, which is what you're supposed to do in a tornado. We would have warning, but sometimes you don't have a warning. So the American Red Cross and Salvation Army are experienced in handling these situations and quickly move in to help. A call for nurse volunteers usually follows. So if you wanted to be a Red Cross volunteer, you could become that soon. You could put in a request for that. Regardless of the area of clinical expertise, there is certain to be a way each nurse can contribute, even if it's deciding who needs help, dividing people up, the people that need the most help because they're injured, or older people or little babies need more help. And then, I'll tell you another story here, because I lived in LA, and because of the hills, we have the mudslides and we had floods. So I was working in the hospital that day, and it was raining, and the water was rushing down one of the hills, and a guy got out of his car at the stop sign and got caught up in the rush of water going down the hill, and he was taken all the way down the hill, and his backside was just full of like rocks and little pieces of cement and things because he was carried down. And my job that day was to pick out all these little stones out of his back. It was pretty bad, but you know, it was sudden. He got out of his car, he didn't even think he was going to be washed away. You don't think of these things. That's why they're emergencies and disasters. So disaster planning, a challenge for healthcare professionals, the Red Cross, Salvation Army, FEMA also helps, and the CDC. So how about some legal aspects of emergency care? So we've talked about how do we help people in an emergency, but what's the legal ramifications of this? So it's important to know that in emergencies, a person may be unable to consent to care. So treatment can be provided under the assumption that the patient would have consented if they were able. Of course, if there was something wrong, they would want help, right? But here's what you need to remember. We do have the Good Samaritan law, which is great, but the nurse, this is the requirement for the Good Samaritan law, and it's in your book under legal aspects of emergency care on page 1260. So the nurse should demonstrate the same skill, knowledge, and care that would be provided by other nurses in the same community with the same credentials. So that's what you're going to be judged by. As long as you do the same thing anybody would do with your credentials, any nurse would do in that same situation, you're fine. If you do something that you shouldn't do, it's not going to cover you because you went out of your scope. So we want to stay within our scope of practice. So like in the book, it says the nurse is expected to demonstrate the same skill, knowledge, and care that would be provided by other nurses in the same community with the same credentials. The Good Samaritan doctrine in most states is intended to limit liability and provide protection against malpractice claims when healthcare providers render first aid at the scene of an emergency. Although many Good Samaritan laws cover nurses, not all do. An important point to remember is that these laws do not protect the nurse in the event of gross negligence. So that's why we say to do what the nurse would be expected to do with the same skill, knowledge, and care that other nurses in the same community with the same credentials would do. And I'll tell you, the state of California, that's the rule they use. That's negligence is the failure to demonstrate the same skill, knowledge, and care that would be provided by other nurses in the same community with the same credentials. So even the state uses that verbiage, but it's the failure to do it, and that makes you liable to get into some trouble. So it does help, though. It limits liability and provides protection when you try to render first aid at the scene of emergency. But that's why it's important to know what's the right thing to do and the wrong thing to do. So these laws do not protect the nurse in the event of gross negligence or willful misconduct. So knowing that you did the wrong thing can make you liable. All right, so now that you learned how to take care of emergencies, now I've scared you to do it, right? Okay, well, just remember, do the best you can do, and you'll save a life one day.